Hey everybody, it's Dr. Joe, and today I'm going to show you how to use the TENS unit for sciatic pain. So let's get started.
Disclaimer alert, disclaimer alert.
So before we get started, if you haven't already, make sure and click on the subscribe button because that helps my channel grow. Today I'm going to use the iReliev TENS EMS wireless unit, which is really nice, and I'll talk about it a little bit more later. So the important thing to know about sciatic pain is sciatic pain can come from two different places. It can actually come from your spine, or it can come from your piriformis muscle compressing the nerve there. So if it's coming from your spine at L4 to S3, those are the areas that sciatic nerve comes out. It comes out kind of in a wave, and then it becomes one big one that goes then down the back of your booty to the back of your leg. So when it comes back through the pelvic area, that's where it can get compressed at the piriformis. And it's important to know where your pain is coming from, because if you're going to use that the TENS unit for relief, you need to know, do I need to put it on my back to get that relief, or do I need to put it on the piriformis muscle area to get relief? So that's why it's really important to know. The main one I'm going to show you today is if it was coming from my back, like if it was getting compressed by a disc herniation or maybe stenosis or some degeneration. So that's just to remember, something to remember. So the cool thing about the wireless iReliev TENS EMS unit is it's wireless, and especially when you're putting things on your back or in an area that's not just so easy to get to, not having wires to worry about makes it really, really nice. Also, what's really cool about the iReliev unit is it has 14 different modes. And so it has for pain control, it has one for arthritis, and then it also has one for muscle conditioning or recovery. So we're going to use the TENS one today. Like I said, I don't recommend using the EMS, the electrical muscle stimulation, where you're actually contracting the muscle on your back. Therapists might use it on your back, but you have to be a lot more specific than just kind of placing it on your back. So I wouldn't recommend that unless your therapist has told you specifically where to put it. So with the wireless, it's nice because you have the bigger pad, which is 2 electrodes if it was wired. So you have the 2 electrodes here, but it's just the one channel. And I'll talk about the 4 wired electrodes in a minute. But it makes it nice because these bigger pads with the TENS, you don't have to be exact in your placement. But the big thing to remember is, since it's a little bit lower, it's kind of a little bit above where your belt line would be and a little bit below. So you would just kind of smack them back there. And that's what makes this so easy, that it doesn't have to be something specific like the muscle stimulation or the EMS. So I'm just going to turn this on, and the big thing is you want to turn the pods on really before. You can do it kind of at the same time, but to get these going, you turn those on, and then you turn your unit on here. And then once it comes up, you want to make sure you see that little wireless connection that it's on, and that means it's able to talk to those. So again, like I said, I'm just going to really kind of slap them on my low back, and then I'll show you where they are. But I want to show you with the wireless, it's pretty easy to do on your own. If you can have someone else do it, then sometimes they can get a little bit more specific placement. But like I said, with the TENS, it doesn't particularly have to be exact. So like I said, a little bit below the belt line, one kind of on each side. So let me show you what I'm talking about. So you can see one was a little bit lower, one was a little bit higher, like I said. Unless you're a little OCD, which is fine, usually like me, I would maybe change it a little bit or have someone change it for me. So then once you get them on, you can just start increasing the intensity. So with a TENS, it should always be strong but comfortable. It should never be painful. So if you're feeling pain, or if you're starting to get some contractions, especially on the back, you don't want that sustained contraction. You really don't even want much of a contraction when it's on your back or your neck area, because since the channels would be crossing the spine for the wired ones, you don't want it to be pulling and going back and forth. You just want to feel the comfort level. So since there's a couple different settings for TENS, I always tell people just try each one and see which one you like best. What I like best and what works for me might be different for you. So again, you can take this into one of your physical therapy sessions and have your therapist kind of figure it out with you, and they might tell you a specific setting that they want for your recovery, which is fine. But for me, I usually tell my patients, if you like this one, it's for pain control, and if it makes it feel better, that's what you want, so use that one. So that's kind of how it works. You can go into some specifics of it if you want to and know how much the waveforms and all those are, but to me, you're trying to get pain control, so just use whatever works best for you. So if you're using a wired TENS unit, which iReliev also has, a lot of times it's different because if you're using your TENS, you'll have 4 electrodes for the 2 channels. So for each channel, the one channel, there's 2 electrodes. And like I said, for the larger wireless, there's the 2 electrodes on the one channel. So it makes it a little bit different because you have the actual 4 electrodes. So how am I going to show you these 4 electrodes? I know Dr. Mo Musselstein is going to graciously be a model so you can see the back. So it's a little bit easier to show you this way than on myself, or it's more fun to show you on Dr. Mo Musselstein. Here would be the back, about at the L4 level, all the way down to S3 into that sacrum. That's where the sciatic nerve comes out, goes down into the bottom area where you might feel that pain down into the leg. So if I was using the 4 electrodes, the one channel that has 2 electrodes, I'd put maybe one here and then one kind of just below that belt line on the booty area. And so that'd be channel 1, and then one here and one here would be channel 2. So you have that cross pattern. That's what you're looking for. And Mo, yeah, it's okay. I can show them the piriformis. Yeah. So if you had your sciatic pain from the piriformis muscle, this is your big glute muscle. Underneath, you have then your piriformis muscle here. And you can see that yellow, that's your sciatic nerve. So the muscle is then pushing on that sciatic nerve. So this is your piriformis right here. It's underneath and then it comes out. So if you're having the pain from that, maybe sitting for a long time, you could either place the large pad for the wireless kind of over the booty area, or I would say since it's a little bit smaller area, you would just use the 2 electrodes for the one channel. And you could either put it above and below, or you could put it horizontally, but you just want it to kind of cross that area of pain. Again, remember with the TENS unit, it doesn't have to be exact. You're just trying to get those patterns, those channels when they're talking to each other to be in the general area of pain. So that would be where it would be if you were looking at getting some pain relief for your piriformis muscle. So there you have it. That's how to use a TENS unit to relieve sciatic pain. If you're interested in purchasing the iReliev TENS EMS wireless unit, click on the link up there. And don't forget to subscribe by clicking down there. And remember, be safe, have fun, and I hope you feel better soon.